Can I ask a question before we start? How many of you have seen the draft education and career pathway framework from APNA? If you haven't seen it, can I encourage you to have a look? It's on the website, the draft, is it? The draft?
Oh, the consultation.
The consultation paper? Yeah.
And
And the reason I encourage you to have a look is it's going to be really important for the general practice nurse workforce in particular, and it's really important because we need to keep in step with the rest of the world on this. So I'm going to talk a bit about this. Some of these slides are really blurry, but they're colourful. But the reason I put them up is I wanted you to see what other countries are doing, and so that when you look at the career framework developed by APNA, you will understand some of where it's coming from. Right, it's just... Okay. So, we all know what the challenges are. Well, I hope we all know what the challenges are in Australia, which is, to say again, increasing chronic conditions, including the ageing of the population, and fewer people actually in the taxpayer bracket to pay for services that we need. Over 40% of you working in general practice, from the last survey anyway, are aged between 50 and 55. So unless you're going to work until you're 80, you're going to be at some time retiring. And to add to that mix, we're going to have a shortage of nurses by 2025. Now, we listened to the Minister this morning, and what every government is after is an affordable health system. And all of the evidence shows that primary care is the most cost-effective place to provide care. It's cheaper than hospitals. So basically, we need to strengthen primary care. If we're going to do that, we need to strengthen the primary care workforce, and we need to be able to provide more comprehensive care to more people. So in terms of addressing the challenges, what's been happening up until now is that people, nurses who get to midlife decide that they would like not to work in hospitals anymore, so they go into general practice. And what we are trying to achieve, what we need to try and achieve, is to attract younger nurses and nurses earlier in their career, so that we can have a clear trajectory for them to work in general practice. The problem we have is there's little primary care content in the nursing curricula and little incentive for younger nurses to join general practice. You know, why would they join general practice when they can go into a hospital and they can see examples of where they could go in their career? So although nurses have been part of GP team for decades, their numbers have increased since 2002. And as we've already heard this morning, there are about 12,000 nurses working in general practice. But we really need to establish the nurse as part of the primary care team and appreciate the skills that they have. So in order to do that, we need to make sure that they have ongoing access to education and a very clear career framework to ensure quality and also retention and to attract younger nurses in. So what I'll do next is I'll just go over a few countries very quickly. So what's happening in the UK at the moment is interesting. Sue Cross is sitting here, and Sue led the team that developed the framework for the UK. And now Scotland and Wales are following that example and doing their own thing. As you probably know, it's becoming very devolved in the UK, so they want to reinvent the wheel because they want their own wheel rather than anybody else's wheel, particularly if it's an English wheel, actually. So in Scotland, they have 4 pillars to their framework. And it's clinical practice, facilitating learning leadership, evidence research and development. So those are the 4 things that they think are really important for nurses to cover for their career progression. I'll now flick back to the WIP framework, which is here. So if you just have a quick look at that, there's 9 levels, and lo and behold, Scotland, you can't see the writing, or maybe you can, but Scotland has 9 levels. So they have taken probably the WIP framework and worked up their own 9 levels. Sue's laughing. So what it means is that these countries are really thinking about attracting and retaining their workforce and actually putting levels in of what you need to do to get to a certain level. We had a day-long session yesterday, and some people in the room were there. We kind of decided against levels. Obviously, the UK is different, but we decided, I think, so to date, against levels. But, you know, the fundamental issue here in this country is that there are core competencies, there are your registration requirements, and all the requirements that you have to adhere to as nurses, and then building up from that as generalist nurses, and then expert nurses, and maybe thinking about taking a very special interest in a particular area. So that's what we are trying to do with the education and career framework, rather than what Scotland is trying to do, which is much more detailed, it seemed to me, or maybe slightly confusing, I'm not sure. So Wales are a bit behind, and where they're at is they're going to look at the WIP framework, and they are aiming for a more robust recruitment process and robust education and training to go with that. Now, this feeds into the need for quality. So nurses, if nurses have been in the hospital for 20 years, they are still new to general practice. So understanding what is required of general practice is part of the process. So robust recruitment structure, robust education and training, and a robust career framework. Even in England, Scotland and Wales, at the moment, despite all the work, there is still not a comprehensive and robust career framework. And it's really interesting now that, like us, they are coming to terms with the fact that if they are supposed to recruit and retain nurses, they need that. What they also acknowledge in the Welsh document is they need a good mix of generalist and specialist skills. And we had a long debate yesterday about this, about generalism. I mean, everybody's a generalist. And generalists might have a special interest or might move into a more specialist area. In fact, might move into a specialism as a nurse practitioner, but a nurse is a generalist first and foremost. The nurse, from the Welsh document, they want to see the nurse in a multi-skilled, competent team. And they want to see the nurse as leader. So the nurse providing leadership to the team, to the multidisciplinary team, including other nurses. And the other issue is that they are thinking that nurses can be shared across practices and localities. Interestingly, Wales have some of the characteristics of Australia, obviously not on a larger scale, but some very small communities that can't access medical practice. So, for instance, where I'm from in Wales, the medical practice serves an area of about 12 miles out. And sometimes they go out into smaller community with clinics, or sometimes they send the nurse because they haven't got enough GPs. They've got, GPs in the main clinic, but trying to get GPs out, travelling out into, Bethel and Rhywlas and places like that, they don't do it. And it's fine if you've got a car, but there's no bus from one village to another unless you go through the town. So they're thinking about using nurses in those kind of situations. Now, the Netherlands is doing the same thing, and it was interesting when I was reading this because I think it's so Dutch, really. It's kind of, they're very focused on the patient care, diagnosis, management, action plans, coordination and quality improvement, and education and coaching other professionals. And the Dutch have done a lot of work in general practice. There's a lot of general practitioners, academic general practitioners in the Netherlands who've done fantastic work in trying to improve their general practice structure. And this is the approach the Netherlands are taking, is really detailing what nurses could do or should do. Then we've got Canada. Now, Canada is a bit like Australia. It's got provinces and a national government, and the provinces all do their own thing because they are in charge of health. So what the Canadian Nurses Association are trying to do is have a common career framework for nurses in primary health care. And they are recommending certification process. That's not part of the thinking around the APNA career framework at the moment, but Canada are recommending a certification process. They are also talking about a supported a transition to practice program. And that's one thing that is on the cards for APNA as well, is a transition to practice program for experienced nurses and for nurses who are newly graduated. The crucial thing as well is that it's going to be supported by primary healthcare education. One of the criticisms that I have heard through my research over a number of years is that education might be available for nurses out there, but either it's inaccessible, expensive, you don't get time out of the clinic to do it, or you haven't got time at the weekend because you've got family. So we need to think, like the Canadians are doing, about how best to present this education. Education that is quality assured, and education that's accessible and affordable for everybody. And like us, they are recommending more primary care education at graduate and undergraduate levels. We are getting better, but we are really, in terms of how nurses are trained in universities, they get about that much primary care and prevention out of that much. And it's very difficult to get clinical placements for them, because it's very new. Clinical placements are an issue anyway, but we need to think about how we do the clinical placements, and other countries are thinking the same way as we are. I'm trying to gallop through this to catch up some time. So New Zealand, the countries closest to us, is really far ahead of us, to be perfectly honest on this. And they are developing an integrated primary health care knowledge and skills framework. And I'll show you one in a minute, which I think is what they've developed is really good. Hopefully you can see it. So this is, again, a much more pillars approach. And they have levels as well, which we don't have. So this will be available for you to have a look at. And please have a look at all of these before you give any feedback to APNA about the career framework. We are talking about expert generalists. You can see here, where's the pointer thing? You can see there, they talk about expert nursing practice. So we need to really think about what we are talking about when we talk about those things. And one of the challenges is that we have a cohort of nurses in general practice at the moment, like New Zealanders and other countries, and we have to acknowledge the skill and training that they currently have. We've got to think about how we do that, because we're not starting the board clean, as it were. And if they have an expertise in a certain area, how did they get that expertise, and how do we measure that? So basically, countries around the world, in North America, in the UK, in Europe, and in other parts of Europe, non-EU countries, are all facing the same challenges as we are. So basically, these are the issues that are underpinning our career framework, or any career framework really, that we really need to work with universities to talk to them and the deans about more primary healthcare content, more experience for younger nurses to go into general practice and not seeing the hospitals as the be-all and end-all of anything. And I think part of that is marketing what general practice can do for their career and having clinical placements and understanding there's a clear career framework there. And that clear framework identifies skills, knowledge and behaviours for nurses to be fully proficient in that environment. We also need to have funding to support a transition to practice, because what we don't want is to have younger nurses going into practice and then not coping and dropping out. So we need to have funding, have nurses mentor them and support them through that process. And I think the other really important factor in all countries, and particularly here in Australia, given the size of our country, is flexible learning for education programs. And, you know, flexible learning is not all about online learning. There are various ways to deliver flexible learning, but it's crucial that we have a flexible learning approach that builds on skills but provides quality education that is quality assured and that is for nurses and probably and hopefully by nurses. So, where to now? So APNA have developed a draft framework and there's been extensive consultation across the country. I did one with Simon. It was really interesting in Wagga, and we spoke to practice nurses and practice managers, and that was excellent. So we've been around the country talking to various groups about it. And Australia is in line with other countries in recognising the importance of the nursing workforce. For so long we have been behind the 8 ball on this, but we are catching up in recognising the primary healthcare nursing workforce. And the framework also recognises that nurses are trained to provide holistic care. And from what Mary was talking about this morning, you know, that's holistic care. And that's what nurses are trained to do. And they need to be supported to do that. And if we are to maintain a quality and affordable health system, a career framework for primary health care and general practice nurses is going to be important for the profession to grow and for nursing skills to be appreciated and fully utilised, and for nurses to have an identity as a primary health care or general practice nurse. Thank you. Was that fast enough?
Yeah. Can we get a copy of the WIP diagram?
The WIP diagram, is that still online?
Yes, I think so. It's being updated at the moment, so you can't get it just at the moment. But I can give you my email address.
We wondered, because we've been looking for it.
Oh, was it you who contacted me?
No, it wasn't me. I've been looking for it.
I mean, I can let you have information about all of these documents that support the Scotland, and because basically Scotland and Wales, Scotland in particular, are building on the WIP.
Sorry, I didn't.
Scotland is building on the WIP, definitely.
Yes.
Yeah.
I was interested in the consultation that APNA's maybe having with general practice, like GPs as well, because no matter how much work we do, it is kind of in the hands of, you know, the GP owners.
Yeah. The RACGP and the AMA have been on the consultation committee, the group for this particular process. I'll let Rhian or Joe answer the question about individual GP consultations, but I think the real key is in the marketing of this tool, because wouldn't a GP want to know what skills you have to offer that practice? You know, what if you can go in and with a framework and say, this is me, I'm a generalist, but I have expertise in this area, I've done this, what I want to do is that. You know, to me, that is a marketing tool and something that a GP can go, okay, that's good, you've got skills in this area, we need that skills, but you're a generalist and you can do all of these things? Yes. So I think it's about utilising the tool to market what you can do for the general practice.
I suppose, and I'm not trying to just sit in the negative area, but often from personal experience, the general practice is not interested. You're a nurse, that's all we want. We pay our nurses this much money and off you go. And your CV, how you know, presented and stuff, that you're really just another number.
Yeah, I understand that, but I think the aim is to change that attitude. I've done a Stanley's big evaluation of nurse practitioners in aged care. One thing we learned from that evaluation, there were doctors, GPs who said there's no way in this wide world I'm going to work with a nurse practitioner, not doing it. By the end, they were positively glowing about what that nurse could do and what it meant for them, that their patients were cared for in aged care facilities or at home or wherever. They knew what was going on because the nurse practitioner was keeping them informed. They built trust and they knew what the skills were and they appreciated that. So I just think it's about, you know, awareness raising a bit.
Yeah.
And just...
And that this tool is taking us in that direction.
Yeah.
Yeah?
Yeah. So you know, it's a tool that you can decide where you want to be and you can decide what skills you want to achieve. And it should be supported by education and all of those other things. But it's a tool that you can say, I want to be here. I don't want to do postgraduate study. I want a little bit of expertise in this area. I know for 3 days a week I'm going to do a lot of other generalist things. But on a Thursday, I might be looking after, you know, diabetic patients or, you know, patients with mental health, whatever, because I've done some training in that area. So what we're trying to do is keep the generalist at the core, that ensure that nurses can respond to the needs of their clinic and their population.
We might have to...
Judy?
Oh, is it quick?
It's very good.
Okay.
It's really just a comment, and I completely get where you're coming from, but I think, and I got to reflect on what Rosemary Bryant was talking about this morning, we've got a cultural issue within ourselves, but also within the people that we work with, and I think that we have to be nuisances, and we have to be very clear in articulating what we need for our profession, and I think once we're very clear on it, we then need to start changing some of those myths that general practitioners have about us and what we do in our profession in general practice. So I think it's a cultural shift, and I understand that it's quite challenging, but I think as leaders, we've just got to make nuisances of ourselves and keep banging on about, no, you're not right. This is actually what I do. This is, I have validated education for what I do, and you might not validate it, but I do.
And just as a final comment, general practitioners need to keep up with the rest of the world as well. You know, it's not just about nursing. They need to understand what's going on in the world with this, and they need to kind of get in the game, really.
We'll get another job.
Like to...